All right, we're going.
All right. So before I begin, I'm going to check any markers or any isolation precautions that are on the door. And I would do hand hygiene before entering. Hi, my name is Meredith, and I'm your student nurse taking care of you today. Can you please state your full name and date of birth for me?
Hannah Parker, December 23, 1995.
And Miss Parker, on a scale of 0 to 10, how would you rate your pain today?
0.
All right, and then I'm going to check any environmental hazards, and there appears to be none. So in terms of general appearance, Miss Parker's face, she appears to be relaxed and calm. Her body position is relaxed and comfortable as well. In terms of her nutritional status, her weight appears to be evenly distributed, and her weight is within the healthy range. She is well groomed. In terms of her skin color, it is even throughout. Ms. Parker, do you know where you are?
The neck.
Okay. And do you know what month it is?
December.
All right. So I know that Ms. Parker is conscious, and her speech is clear, and her hearing, she is able to answer my questions appropriately, so I know that she can hear me. Next, we're going to move on to neurological. So first, I'm going to check her pupil size to see if they're reactive. Will you look at my right shoulder? Good. So her pupils are they're reactive to light, and they are 2 millimeters, and they do constrict to light as well. Next, Ms. Parker, would you mind swallowing for me? Good. And she is able to swallow. Next, I'm going to have test her motor strength. So will you grab onto both my hands? Good. And then will you press your feet against my hands? Great. So she has motor strength, strong and equal bilaterally in both the upper and lower extremities. Next, I would note any POTUS or facial droop, and then I would test sensation by having her close her eyes and touching her at different parts. Can you feel me touching?
Yes.
Can you feel me touching?
Yes.
Good. Next, do you know what my name is?
Meredith.
And do you know what month it is?
December.
All right, so I know that she is alert and oriented times 3. She is she can verbally communicate. Her verbal response is strong, and in terms of her communication, it is logical. Next, I'm going to move on to respiratory. So first, I'm going to check the placement of her supplemental oxygen to make sure it fits. How does it feel?
Good.
Okay, and then I'm going to check the source to make sure that it is set at the correct flow rate, and it indeed is. Next, I'm going to watch Ms. Parker breathe. Good, and her breathing is unlabored, and it is even and effortless. Next, I'm going to, Ms. Parker, would you mind coughing for me today? And then would you take a deep breath for me? And Ms. Parker doesn't have a cough, but if she did, I would assess the color and the amount of mucus. So next, I'm going to listen to her breath sounds. Warm up the stethoscope for you. All right. So first, I'm going to start in the right upper part of her chest. And then would you take a deep breath for me? And then left upper, right middle, left middle, and then I'm going to do right lower, and then left lower. Good. And then would you mind sitting up for me? I'm going to start left upper, right middle, or left middle, right middle, left lower, right lower. Good. And you can sit back down. So her lung sounds are clear. And then, if necessary, I would teach her how to use an incentive spirometer. Next, I'm going to move on to cardiovascular. First, I'm going to check her capillary refill in both her hands and her toes, and it is under 3 seconds. Next, I'm going to listen to her heart sounds. First, with the diaphragm. And then I would listen with the bell. All right, and next I'm going to listen to her apex. I'm looking for an irregular beat, and I would do this without a gown on. And it appears to be regular. Next, I'm going to take the apical and radial pulse simultaneously. And I would do that for 1 minute. All right, next I'm going to check for any pretibial edema. So I would roll up her pants legs, and I'm really looking for any swelling. And there is none. Next I'm going to take her posterior tibial pulse, and I would grade that as 2+. And then dorsalis pedis pulse, I would grade that as 2+ as well. Next I'm going to check her IV fluid, and I'm going to make sure that the rate is correct, and I am going to make sure that the skin site where the IV is inserted is all good. Next I'm going to move on to skin. Her color appears to be white and pink. Temperature is warm and dry. For turgor, I could either test right here on her or up at her clavicle, and I'm testing for elasticity. Next, I would assess her skin for any breakdown, and I would make sure I check her backside, and I would note any lesions or any breaks in the skin. I would also assess any dressings, and then I would use the Braden scale for skin breakdown as well. Next, I'm going to move on to the abdomen. For this, I would lower the bed so that she is flat. By looking at her contour, it is flat. And then next, I'm going to auscultate her bowel sounds. And I'm going to start at the right lower quadrant, and then I'm going to make my way up to right upper quadrant, left upper quadrant, left lower quadrant. She has active bowel sounds in all 4 quadrants. Next, I'm going to lightly palpate each of her quadrants, starting in the right lower, right upper, left lower, and it is soft to palpation. And I would assess any drainage tubes necessary, checking them for amount and color. Next, Miss Parker, have you had a bowel movement today?
Yes.
Good. So I know that Miss Parker is continent. How are you tolerating your diet?
It's tolerating well.
And she is able to tolerate her diet. Miss Parker, when was the last time you voided?
Yesterday.
Okay. And if necessary, I would assess the color, clarity, and amount of urine. Next, I'm going to assess her activity. If she was on bed rest, I would make sure that the head of the bed is at least 15 degrees or higher. Next, I would assess her SEDs, TEDs, or foot pumps. I'm just making sure that they're on and working, and I'm checking to see how long they've been on for. And then if necessary, I would help Miss Parker to a chair, and I would note any assistance that was needed, or if she was able to tolerate the move. And then I would also note any ambulatory aids that were needed in the process of the move. And then I would also assess her using the NURS scale for fall risk. To close, I would make sure that the bed was lowered to the lowest position. I would make sure that the call bell was within reach, that the brakes are up, they're on. The side rails are up, the bed alarm is activated if needed, and I would document any of my findings.